Colorectal cancers are one of the most preventable cancers, and the ways that we can prevent it are the tools we have for screening. Over the years, there have been very effective tools to help detect polyps before they become cancer, as well as catch cancer at its earliest stage when it's easiest to treat. There is an association with alcohol. So we know amongst younger people who consume greater amounts of alcohol that there tends to be more colon cancers and more being more than 2 drinks per day, more than 14 drinks per week. In those groups, we're seeing higher rates of colorectal cancer. There is also data that shows that ultra processed foods, so foods that are very far removed from how they look when they are grown, for example, a lot of prepackaged foods or a lot of sweetened beverages, these foods have been associated with development of polyps, and those polyps are the ones that can then progress to become cancer. The last thing I'll add is obesity. So we see a really consistent trend in rates of obesity and rates of colorectal cancer, signaling that there is an association between those two paradigms that's leading to the observation of more cases and more deaths in young people that we see today. I would encourage anyone who is due for screening to not delay because really survival from colon cancer is greatest when it's captured early. We know that for people who are diagnosed with colon cancer, when it's still within the colon, that 5 years after that diagnosis, 90 to 95% of them are alive and well. If we wait for colon cancer to leave the colon at that same 5-year mark, only about 10 to 13% of people are doing well. So don't delay screening. It could make a significant difference.